Okay, okay. Yeah, and this one is very new to me. Like, I mean, we are not aware actually many things.
It's
Actually,
available.
parents need awareness, I think.
Huh?
Parents need to be educated first, I think.
Parents
Mm.
do not know about all this. They're very
Uh,
unaware. And when you read
uh,
about the harmful effects about it, like even I was
mm,
unaware about all these drinks
mm,
until I started practicing here. And then when
mm.
I realized, I was seeing every school child after school when they're going back home, they're drinking this and going. Like from a very young age. It must be like from 5 to 6 years old. And you're starting to have so much of caffeine in your body and you're unaware about it and it's causing so much harmful consequences.
Yeah,
Yeah.
really shocking.
Yeah. And you were asking me about addiction as well, right?
Yeah,
So,
yeah.
how do you know when a person gets addicted? So, I told you
Mm,
about novelty seeking and low harm avoidance.
mm,
I'd
mm.
also like to tell you some very, like, few other important points. So, how do you know when you're like falling into that addiction category? Is when you have a very strong sense or the urge or the desire to keep taking the substance repeatedly. Like, you know, how much ever you're controlling yourself, but you're unable to stop taking. You're again and again seeking for it. That urge to take or that you can't, there's very difficulty in controlling yourself to take that substance,
Mm, mm,
and also your tolerance level is decreasing. Means previously, I'm going to give my example here. So previously, if I was just smoking one cigarette or if I was just taking one peg and I was feeling high by it, but now I need to keep increasing my quantity, you know, to get the same desired effect. So it's like after 1 week, I'm not going to feel the same high like I was feeling 1 week before. Now I need to have two pegs to feel
mm,
the same
mm.
high. So
Yeah.
this is how your tolerance is keeping on increasing.
What is the
You
reason for the
understand?
tolerance actually in the brain? What
Because your
happens?
brain,
Mm,
because the receptors are completely, like, what can I say is, see, when you're drinking alcohol, your the substances go and get connected to the receptors, right, in your brain. So those receptors are what are causing this voltage gated channels, and that is what is causing this different kind of changes. You're feeling that euphoric state because of that, because of the dopamine circuit that is happening. It's causing increased pleasure. It's called as reward sensitivity. Our brain
mm,
gets easily sensitized. But what happens is once that amount gets, it's like sensitization. Our brain is sensitized to that amount. So with the same amount, nothing anymore, nothing is happening. It's like conditioned to it. So you need to have more and more quantities for it to be more and more sensitized. You understand? So
mm.
that is why you need to keep on increasing your usage. You need to keep on increasing the frequency. You need
To
to keep
get
on
the
increasing the dosage
the threshold
to
is
get that
increased.
same height.
Uh-huh.
Yeah, your threshold
Mm,
is increased. That is the thing.
mm, mm, mm,
And also, there is evidence of withdrawal state. Like, even if the person does not take for 1 day, or be it even 12 to 16 hours, if I've taken yesterday and if I'm not taken today the whole day, today by evening time or whatever the patient's, however the patient's frequency of taking it is, there'll be development of withdrawal symptoms. Like, there can be tremulousness, the whole body is shaking, there can be hand tremors, it causes seizures, it can even cause delirium.
mm, mm,
In delirium, as you know, there's disorientation, there are memory disturbances, you do not know where you are, there can be
mm,
hallucinations. That is psychotic symptoms develop
mm,
because of it, because of all
mm,
these withdrawal symptoms. And also, there'll be neglect of all your daily life activities, like things that previously gave you some interest or gave you joy. That is not there anymore. You're not
mm,
interested to do anything. You're very disinterested in doing your daily
mm,
activities. You do
mm,
not have the fire to go for your job anymore or to work. You just want to be at home and
mm,
keep
mm,
drinking and keep doing that. Having a very sluggish life is
mm,
what I would say.
mm, mm,
And also, people will keep on persistently using drugs even if they know that it's very harmful for your body. They
mm,
know that it's going to cause harm. They know that it's going to cause multi organs, some or the other dysfunction. But still, people will continue using it despite knowing
mm,
whatever detrimental effects it has on your body.
mm,
So,
mm.
these are some of the points that
I
lead
think for
you to a
children,
conclusion that a
okay, I
person
think
is.
for children to an analogy like a ghost, maybe dressed up like an angel. So initially they just inviting them, befriending them, and then when they leave them in the house,
Yeah,
the real form is
exactly.
then they go into just whatever they felt. It becomes just the opposite. The initial few usages is different, and maybe a high performing, very good, maybe attractive looking child ultimately gets converted into a poor looking like what to say, very emaciated, poorly
Yeah,
performing.
imagine.
Yeah, and mentally very incapable. Everything is disturbed.
Exactly. The
Cognition,
performance decreases
uh,
overall.
IQ. Maybe they go into just the opposite of whatever they were before. Yeah,
Very
that's
true.
really horrible. Please, God, it's very interesting to listen. Mm.
Yeah. So, like, I these are, and I'll also like to tell about, like, you did not know about Sting and all of that, right? Like,
Mm.
I would also like to tell about some very common substances that we see in India. So, as we all know, like, alcohol always ranks the first among using any substance. Alcohol always ranks the highest among statistics, also, if we see in research and all of that. But alcohol also varies upon, you need to know about geographical domains also. Like we need to know that in Punjab, in Northeast, in Kerala, and all the consumption of alcohol is much higher than in other parts of India.
Mm. Mm.
Second most common that is used is cannabis.
Yeah.
It's increasing a lot.
Mhm. What
So
are the other
cannabis
names of
means you,
cannabis? What are the other names?
huh?
The other names of
Weed,
cannabis. Weed.
weed,
Mm.
ganja,
Mm.
charas.
Uh-huh.
These are some of the other names
What
that
is
are used here.
what is harsh? The something like that.
No, hash is like more like an opioid.
Okay, okay, okay. Mm-hmm.
Yeah. So opioids may we have this heroin, brown sugar,
Mm-hmm.
hash, and all. And in opioids, we mainly see that IV usage is more.
Mm-hmm.
We
First
take it
we
more like
go
that.
with cannabis.
Yeah.
Mm.
So cannabis, we have bang, ganja, charas, and
Mm.
bang and all is very commonly used in Maharashtra and all during Holi. It's a
Mm-hmm.
very holy drink that they use and
Mm.
they consume, which has cannabis in it, and people get a very temporary high out of it. Then
Once
there
in
are
a year.
prescription
Once in a year during Holi.
once in a year during Holi. It's
Okay.
very commonly used. It's a
Mm-hmm.
very cultural thing. So I think all the members in the family actually drink that.
Okay, okay, okay.
Yeah. Then there are something, even prescription drugs are very commonly misused.
Mm-hmm.
And something under psychiatry comes benzodiazepines, clonazepam, alprazolam. They
Yeah.
are misused. They are not given over the table, but in many states, I have seen that those drugs are given as over the table drugs. The
Mm-hmm.
pharmacist just dispenses them even without prescriptions.
Mm-hmm.
And like when
Actually,
patients
I
come to
feel,
me, like
Dr. Reshma, I feel if an like a non-addicted person goes and if he tries to get these drugs, be it prescription medication like the benzodiazepines or some other street drugs, I feel a
yeah,
non-addicted person, it's very difficult for them to get it from the whoever it is. But one who's addicted knows and he will get it for sure.
however they get it, that
Yeah,
is the thing. No, they know how to procure drugs
yeah,
very
yeah,
well.
yeah.
They also have people to help them out.
Mm-hmm.
When it comes on the basis that you know that your health is getting neglected or getting impaired, they'll find out ways to get it.
Yeah, they have a big
It's a very
network.
high
Mm,
trade that,
mm, mm, mm,
yeah. This prescription drugs also, they are getting it very easily. The
mm, mm,
stimulants, be it even CNS depressants like benzodiazepines, even opioid painkillers like tramadol and all.
mm, mm,
Fentanyl, tramadol. These are
mm,
used like in a very wide usage. You can see
mm,
them
mm,
drinking this
mm.
codeine syrups.
Yeah, yeah. In
Yeah,
children, in babies, like children, we used to give one or two, like for 10 ml, 5 ml, like that. But slowly, it will be
exactly.
like going to
You
that.
start developing.
Mm,
And one thing which is very common in low, like in the underprivileged community areas are inhalants.
mm, mm,
They inhale glue,
mm,
whiteners, paint
mm,
thinners,
mm,
petrol.
mm, mm,
And these are all which cause very rapid and short lived highs in the
mm,
human
mm,
body.
mm,
And these are very cheap and very easily
mm,
available.
mm,
So we see even rampant usage of all this.
mm,
And then synthetic drugs are very common these days. These are coming in mainly urban population because of
mm,
increased modernization. These
mm,
are what we see in parties, in
mm.
clubs, in
Uh-huh.
nightlife and all. They are mainly this methamphetamines,
Amphetamine.
cocaine,
Pencyclid,
MDMA,
PCP. Mm,
phencyclidins,
mm,
LSDs.
mm, mm, mm,
These are all synthetic drugs.
So what are the ways they'll be consumed actually?
So there are like various ways in which they consume, you know. So first of all, we know that orally. Orally is
Mm.
one very common way where they are taking it through. It can be any liquids, it can be pills, it can be syrups, whatever it is that is taken orally. There are transdermal patches allowed there available nowadays that
Mm.
also keep on releasing drugs. Like how there are nicotine patches,
Yeah, yeah.
the
And
same way
surgical
there are
patches
patches
like
available. Yeah, the same way patches available for taking drugs as well.
mm, mm,
Then other way is inhalation, where they take whiteners, glues, smoking also. Even passive smoking
mm,
is as harmful as doing active
mm,
smoking.
mm,
Then there are injections, where I told you
mm,
that opioids are very IV drug uses are very common
mm, mm.
in opioid consumption mainly. Then also we have this
Marijuana?
sublingual.
Mm, mm,
Marijuana can be taken in powder form. It can be
mm,
snorted. It can be inhaled.
mm, mm,
Then we have something called as dissolution as well, which is kept between
mm.
the tongue and cheeks and taken. They
Uh-huh,
are very small papers which are
uh-huh,
transparent, translucent, and they keep
uh,
that between the cheeks in the buccal mucosa area. And you
mm,
wait until it dissolves.
mm,
So these are some of the very common forms that
mm,
people consume drugs in. As far as like I'm also aware about and I've seen in
mm,
practice.
mm. And what are the other effects? Maybe it will cause frequent infection also. I heard this marijuana can be diluted in water, and that water is also injected IV, some things like that.
Yeah, they inject it with normal saline.
Hmm, hmm, hmm.
They inject the whole paste into the thing. And what causes is because of injecting it, it can cause itching.
Uh-huh.
A lot of itching over that side. And also, they tell that these people also feel like there is mite infestation they develop delusions
Hmm,
that there
hmm,
is some infestation of mice, parasitosis, and all crawling under their skin.
hmm, hmm, hmm.
This is very common with people who
Hmm.
take IV
Maybe initially
usage.
they start with the nasal inhalation, this powder, and then slowly, when the tolerance reaches a high threshold is increasing, then they start injecting IV. Is that so?
It's not like that. It's not totally
Mm,
necessarily like that. Some people start directly with IV usage.
mm,
Totally depends on the availability of how you get the drug
mm.
form, and
And
also
the
how
effect is
the
very
peers and
fast.
around
The
you are
effect is very
taking.
fast, right? Like when they inject IV, the peak symptom, the peak effects are high is reaching like very fast, right? When there's IV
Very,
injection. Huh.
it's within minutes,
Hmm, hmm, hmm,
but it's not that. It can, like, you know what happens is because there is increased, like, from the vein it directly reaching your
hmm, hmm,
receptors, which is
hmm,
actually causing very, I can only tell that it's causing, the effects are very fast and
hmm,
it's actually
hmm.
long lasting
Oh, oh, okay.
than the other type. It because it enters into your blood circulation very directly.
Hmm, hmm, hmm,
It's not like the other form where it takes some time to reach your blood circulation. This is
hmm,
very, so it causes an effect on the entire body also very
hmm,
fast.
hmm, hmm. So it's in fast forward mode, the action.
Yes.
Hmm, hmm,
And like, you know what they tell is with this IV drug use, they also tell that this weight loss, then insomnia, and sweating, and all is very commonly seen when drugs are injected into your body.
hmm, hmm,
Because with oral and all of that, the effects can only be seen after an intermediate period of time.
hmm,
But when you start using IV, acute effects are seen.
hmm,
It's
hmm,
very quick.
hmm,
Changes
hmm,
can be actually seen.
hmm,
And
hmm,
also, it causes loss of sex drive in
hmm,
males
hmm,
taking
hmm,
IV usage.
hmm.
And as you must be knowing, a lot of STDs also spread
Yeah, yeah, yeah.
by using IV,
Yeah, by the
which
needle injection. Mm.
with needle injection, which people are
Mm.
not very aware about.
Mm, mm.
Yeah.
So how is a parent going to be responsible for this? Of course, parent has to take responsibility because there is no other person to help them out in this. So what
Yeah.
are the things any parent have to be having in mind to suspect and to see what are the warning signs and behavior changes?
Okay. So, you know, in Indian households, it's a very common trend that we do not talk openly with
Mm,
children
mm,
because they're very scared that we are going to insert ideas into them, which they
mm,
do not have. But it's the opposite of it. The more you hide, the more you do not talk, the more you're
Mm,
very restricted in
mm,
displaying your emotions or being open in communication with them, it's only going to cause adverse effects in your children.
mm,
So, first of all, when a child starts coming, like, start talking about common drugs and all from the age of 8 or 9.
mm,
Start talking about common drugs. Start talking about what all they might see in school, what all the children might come across. A parent really needs to have a very open communication pattern in the
mm,
family.
mm.
Flowing of ideas, flowing of thoughts, flowing of emotions with children is always going to be very helpful.
Yeah.
You need to always have that rapport where they
Yeah,
see
like
you
a
as a
friendly,
friend as well.
yeah, yeah, friendly. And there shouldn't
Yeah,
be any block or the prejudice shouldn't be there in the relationship, right?
exactly.
Judgment.
They really need to know that you are there for them
Mm,
rather than
mm,
punishing them. Even
mm,
if they have done something, rather than punishing them, they need to be
mm,
aware that
mm,
you are going to
mm,
be there as a help for them. You're going to
mm,
support them.
mm,
You're going to
mm,
let them
mm,
teach them to overcome it.
mm, mm, mm,
Parents can actually, a very important thing is parents can actually teach their children about, you can do role plays at home where you teach children about assertive communication,
mm,
teaching children to tell no.
mm, mm.
This is very important because children are sometimes placed in very risky situations or in situations where they cannot escape
People
from.
pleasing tendency and as it told,
Yeah,
assertive behavior.
assertiveness.
That is,
Assertive communication is very
mm,
important.
yeah,
And I
yeah.
think parents are the only ones who can
That's the
train it.
boundary,
Teachers,
boundary. They should have a
yeah,
boundary. Yeah. Mm,
teachers can do to a certain extent, but it's
mm,
mostly the parents who play a role in this. Like,
mm,
you really need
mm,
to teach your children how to tell no to their peers in a very firm,
mm,
but also in a very, like, in a very humble tone.
mm,
It
mm,
shouldn't go out there, it shouldn't sound harsh to others.
mm,
But they need to tell them, you need to teach your children how to tell no to others, how to
mm,
escape situations if they are ever placed in
mm,
situations where they
mm,
are forced to take something that they do not will
mm,
to.
mm,
And a very important thing is that parent and a child should always use some code words or phrases.
mm, mm, mm,
The thing is, if that child is going to text their mother, or if the mother calls them and if a child uses that code word, it should be an emergency word where the parent is aware, okay, my child is in some kind of danger or somebody is forcing something on him and I need to make him or her escape from that situation.
mm, mm.
Using of such code
Yeah,
words,
yeah,
training
yeah.
them, using such role plays with them,
Uh.
and all of that is very important.
Mm.
That really builds some kind of, this is all building resilience in your
Yeah,
children,
yeah.
teaching them how to cope up with situations.
That is a part of critical, like when there is a critical event, how to act. No critical
Yeah,
situation, how to respond. Critical thinking. That mentality has to be, yeah, like impinged on the children's mind actually.
exactly.
Mm,
And also, parents should always like tell children to keep enhancing their life skills.
mm,
I
mm,
mean, even whatever your child is interested in, whatever hobby it might be, however small or big it might be, never let them down or never let them stop their creative part of thinking.
mm,
Because I
mm.
think the day or the time when a creative part or when a creative thought process of a child is stopped, that is when all of these things start developing.
Yeah, I feel that is a big let out. The energy of the child is being let out in
Exactly.
creativity. And if it
Creative
there's,
thinking.
yeah, if it is blocked, and all the energy will be shown in something like mentally disturbed, and they wanted now some other let out. Hmm?
Exactly.
Mm.
Like in our times, I'm sure that we were children who were allowed to go and play down for a very long time after
Mm.
school. But that is not
Mm.
there anymore. Children don't let their
Mm.
parents don't let their children go anywhere. All children do is either have tabs at home or have laptops or they're playing video games in the computer after coming back from tuition class and school. So, where is that process gone? Where is that creative part gone? There is no energy outlet at all. Like there's nothing that they do. And then there is just so much of piled up of emotions, a piling up of thoughts that are happening inside that, as you said, there's no venting out. And that is what easily causes them to get into such circumstances or situations. So, always keep appreciating them, whatever it might be. Always keep building upon it. Keep building upon your hobbies, interests, whatever it might be, however small, however big. And also, I would like to say that see to it that your child always has a very healthy lifestyle
Mm,
that is going to work out. If it's embedded since a young age, it's always going to be there throughout your life.
mm,
You know,
mm,
always tell them about the impact on your bigger future,
mm,
like your health, like how it,
mm,
like you always start talking about this thing since a very young age,
mm, mm,
like having a very healthy routine, eating healthy. You know, when you
mm,
eat healthy, you're not going to feel sluggish or lazy throughout the day. If you do not eat healthy, if enough nutrients are not reaching your body, you're going to feel very low. And then people turn out to taking the substances to get that energy increase in them.
mm, mm,
So, you know, always eat healthy, drink
mm,
healthy stuffs, always,
mm,
and always take care of their sleep hygiene as
mm,
well.
mm, mm,
Make sure that they sleep well for 7 to 8 hours, depending
mm,
on their needs. If they need more, then more, definitely. And also, like, do not allow them to see screen for 1 hour before going to sleep.
mm,
You know, sleeping well and all as a huge adverse.
mm,
It has a good impact on your health. That's
mm,
what I mean to say. So, like, focusing on these things.
mm.
And you know, like whenever a
I
child
think,
comes to you, say
mm,
something bad about their day and all of that, like
mm,
if in their teenage years and all, you know, very commonly you see children telling that my day did not go well. Now
mm,
I need to, you know, sometimes as
mm,
adults you say, no, my day did not go well. Now I need to go and get a drink. This is a very
mm,
common things that you see in movies or with
mm,
your friends or anything. So from a
mm,
very common age, from a very young age only, when a child comes and tells you that they have not had a good day or they have not had a bad day, always frame those sentences in there. When they tell it aloud to you, always reframe it and tell it back to them. When they tell you that my day is not gone good, now nothing good is happening or something,
mm,
always frame it, reframe it. Tell them that okay, if today is not gone good, then tomorrow is
mm,
always going to be a better day. Or you can tell them something like, okay, let's make the day better. What can we do to make the day better?
mm,
Like be kind to them, teach them new methods on how to
mm,
reframe their thoughts or their negative thoughts,
mm, mm,
so that will also not lead them to taking a dip in
mm,
their
mm,
routine or in their activities.
mm.
So these are some ways in which parents can actually train
Yeah.
children or
And
help
also,
children.
Dr. Reshma, also this sense of achievement in a child, as you told, like even a small achievement, that gives a
Yeah.
surge of dopamine and that they become happy and encouraging them in that, slowly progressing them in that. Some say it is sport or art or even some any minimal
So, you
thing.
know, that is
Mm,
why you say physical exercises and all are important, right? They
mm,
release endorphins, which are very
mm.
happy hormones.
Yeah, yeah.
So, you know, you need that kind of dopamine rush.
Mm,
Eating
mm,
chocolates,
mm, mm,
you know, we can always replace
mm,
doing drugs or substances with something healthier.
mm, mm,
You know, so teaching them those ways is very important, or
mm,
making them acknowledge that okay, there are certain other ways as well is very
mm,
important for the parent to
mm.
do.
So
I think
one
that
day,
only a parent can do.
yeah, like in a day, they're able to do such a performance, and as the day progresses, when they're increasing the performance and whatever is the small thing they're doing, I think that will also increase slowly the release of dopamine, and they'll feel happy by an innate sense of happiness without any external support.
Definitely.
Mm, mm,
Definitely. So when you accomplish
mm,
things, be it us as well, if we accomplish our schedule according to what we have
mm,
planned in a day, there's always a sense of satisfaction in
mm,
us.
mm,
You know, you do not want anything more.
mm,
So, you know, this being lonely, being idle
mm,
in life
mm,
are the
mm,
most triggering factors
mm,
to
mm,
doing these things.
mm,
So,
mm,
if we're always in a busy state of mind,
mm,
always
mm,
kept busy, always knowing
mm,
that we have something else to look up to,
mm.
we're never going to have such thoughts. We never want
Mm,
anybody else.
mm,
We are usually occupied with doing our own things.
mm, mm. Some,
So, these are some basic
sometimes I feel
activities.
focusing like even in higher secondary, comparing even my son, when they are interested in studies full time, maybe some coaching and aiming for NEET or JEE or whatever, or any maybe in IB board or whatever is the syllabus, if we allow them to focus even in studies, the outside distraction will come down if they are
Come down.
interested, not forcing them, but if at all they having that innate quality to focus on the studies or any sport or anything like dance, if they go into that, the other distractions are almost like absent.
Exactly. So, always like
Mm, mm,
keep reinforcing their interests
mm. How
so
about
that they
journaling?
just keep
How about the role of journaling?
journaling is really
Mm,
great, but I think
mm,
you really need to you can't really do it with very young children because they can't
mm,
articulate their thoughts very well. So
mm,
after a particular age or age group, journaling is kind of the best activity one can do. You know,
mm,
you're really all of your piled up emotions, you're just venting
mm,
them out.
mm,
You
mm,
know, and when you go back, when you
mm,
write down things about your thoughts, about what you did after that particular thought in a
mm,
particular
mm,
state of mind, when you
mm,
actually journal and when you let it out, you can
mm,
always go back to it and then you can think of different ways
mm,
in which you could have actually handled that
mm,
particular situation. You know, it always opens up new ways for
mm,
thinking.
mm,
So I think journaling every day about what you want, about what you have done throughout the day, about things you have been grateful for, about your goals in life, about short term goals, long term goals. Writing your short term goals and long term goals is very important because then you know that you have a sense of fulfillment, that you need to complete those things. You need to achieve those things. When you have all of that, it's great. So these are some of the creative things, and mainly journaling is a very good vent out option for adults, I would say. Doing it daily is going to do no harm to anybody.
And as he told, reframing the thoughts, negative thoughts.
Yeah.
Mm, mm, mm,
I think I'll talk about another session. Like it's something called as cognitive behavioral
mm,
therapy,
mm, mm, mm,
where you're actually
mm,
reframing your
mm,
thoughts, your negative thoughts, based on
mm,
thoughts, behavior, and emotions.
mm, mm,
So that is also one of the major therapies that we do in psychiatry. So that is
mm,
mainly
mm.
it's done a lot frequently in addiction as well.
Okay, okay.
Hmm.
So the main thing is the parent has to be watchful and they have
Yeah.
to be aware of these things and what are the changes. They
Yeah.
usually the mother may be the first person they are able to even notice the minutest difference in the behavior is the first mother will be the first person who is able to notice probably. So they have to be very aware and just watchful, keep it in mind, and as he told, a friendly rapport with the child is mandatory.
Yeah.
Mm.
Mother can also keep a lookout for their social networking,
Mm,
their social
mm,
groups, with whom are
mm,
they connecting, their
mm,
network groups and all of that.
mm,
I mean, whoever stays at home, whoever is looking after a baby for a major period of time can always have a look down for all of these activities of the child as well.
mm, mm,
Like encouraging them to be with positive groups.
mm,
You know, in schools as well, a very important point came up. But in schools as well, they can always make peer groups. You know,
mm,
we advise this to a lot of teachers where they can divide
mm,
the class like with 10 students. They can divide into how many of students are there in the class. Each like 10 students, they can divide them into groups, and then you can actually keep a monitor for that one particular group. So that
mm,
one particular group has to do all of their activities together throughout the year.
mm,
So
mm,
what happens is no person is left alone.
yeah.
No person feels like they're left behind.
They are always
Everybody has
belonging to
that,
a group. They
they're
are always
always belonging. They
yeah,
get that
yeah.
feel of belonging.
Mm, mm,
Wherever this feel of belonging is there, wherever they know that somebody is looking after them, they're never going to go in a wrong way then.
mm,
They're
mm,
always going to have people to look after
mm,
them.
mm.
So this peer group system and all is very important.
Yeah. Mm,
Yeah, this is also one important thing that we usually advise teachers if they feel that some child is actually withdrawing themselves
mm,
or academically declining.
mm, mm,
These are some points that we can look for
mm.
and we can advise.
Yeah. I went in a school for BLS, this basic life support training, and that time they told a few children are very much distracted, and all these maybe is suspecting some additional negative traits in them. That time, when at the completion, I encouraged few of those children, and they become very much motivated that they were able to do
Okay.
it, and they can replace a doctor, and they are able to perform it. Of course, they are able to understand the steps. It's very simple because they are in the learning phase. They grasped everything easily. And those few children, they were like, I'm going to become a medico, so I want to do
Great.
something, whatever you're doing, we are going to do it also. So the way they were feeling confident at the end, I was so impressed, and I got I got addicted to do in schools more nowadays because the way I'm feeling the same energy in me and motivating me
They
how
would have seen
to
you as a role model when you would have
yeah
gone.
yeah
So they'll always get inspired by people who go to
mm,
schools, who go to
mm,
colleges, who help
mm,
them out,
mm,
who are teaching them.
mm,
When they see that
mm,
somebody has actually accomplished something,
mm,
they also have that urge
mm,
to
mm.
accomplish few things in life.
Yeah.
So
And
I think
maybe,
always having important role models or showing
yeah.
them important role models is very
Hmm.
beneficial that way.
Mm, mm. And maybe nobody has praised them or given a compliment or given a confidence that they're doing
Yeah.
well, they are capable and they are performing well and they are good in something. Some that thing was lacking maybe. So that one small aspect was being satisfied by this training, and they were like, "I'm going to come for your future trainings and I'm going to guide other school children. Please take me." Like that sort. I was so much impressed. So in that same can be done in any other part of the school, any small activity, everything they can do like this.
Yeah.
Mm.
You can always praise children if they have done something good. You can
Mm.
always reward them. A
Mm.
very easy thing is just ticking stars for them
Mm.
in a
Mm.
very
Mm.
young age group. Like
Mm.
that is
Mm.
something we do very easily, right?
Yeah,
These are
yeah.
very small, small things. When they know
Mm.
that they are praised for something good they have done, that is just reinforced in their head.
Mm.
Rewards are
Mm.
always reinforced.
Mm. Mm.
Punishments are usually averted.
Yeah, yeah.
So these things, like when you know that you're doing something good and your parents are actually or your teachers are actually complimenting you in front of others,
Mm.
they'll always tend to do that thing again and again.
Mm. Mm. Yeah,
Even
the self-image of a child has to be elevated by the teachers or especially the parent and
yeah,
maybe the community. They have to have that sense of little elated feeling. They're doing good. They are capable, especially in the growing age.
yes, definitely.
Hmm.
It's a very crucial play. I
Hmm.
think parents have the most important role,
Hmm.
more than teachers.
Yeah.
Parents tend to be busy these days.
Hmm. Hmm. Hmm.
So that is also one drawback that we see.
Hmm.
And I think removing even 1 hour of your day
Hmm.
and committing that hour for your child, asking them
Hmm.
about their day, asking them
Hmm.
about their whereabouts,
Hmm. Hmm.
giving them that emotional support that they need
Hmm.
will go a
Hmm.
very long way in the
Hmm.
upbringing of
Hmm.
children.
And maybe in once in a weeks, they can just be off the social media, the parents and everybody just go out in nature and
Definitely.
something undistracted space where they can really connect with the even as you told, even though
Definitely.
they are in the same room, sometimes they are not even getting connected. They're
Everybody is on the
emotionally
gadgets.
disconnected. Huh.
Yeah.
The
At least
availability.
you can always keep gadget free timings, like
Hmm.
while eating meals
Hmm.
or while having a conversation.
Hmm.
I think those places should always be banned from
Hmm.
using
Hmm.
gadgets.
Hmm. Hmm.
You should not bring your phone to the table. There should be
Hmm.
there should be boundary settings even at
Hmm.
home
Hmm.
so that children are aware about it.
Yeah, definitely.
Yeah.
So it was very nice conversation, Dr. Reshma. Glad to connect with you for this. It was so
Thank you.
enlightening. Hope we meet soon
Thank
and
you.
as and when you're available on this and elaborate more.
Definitely, definitely.
Yeah,
I'll get into it more deeply.
sure, sure, sure. Thanks for sparing your time, Dr. Reshma.
Thank you. Thank
Thank you.
you.
Thank you. Bye bye.
Okay. Bye, ma'am. Bye.
Bye.